Hi guys, this is another virtual patient of mine that is combination of bunch of different patients that I have throughout my intern year, and I'm going to discuss about the assessment and plan I wrote for this patient. So the story is that this guy was involved in some kind of gang related fight, was hit in his head with a baseball bat, started to have really bad headache and vertigo after that, waited a couple of days to see if it improves. It didn't improve and he came to the hospital. He was involved in a similar fight many years ago and he had traumatic brain injury and PTSD as a result of prior injury. And in exam, he was found to have Bell's palsy, which he was not aware of. So the number one problem is the Bell's palsy of the right face. And etiology, I wrote it's likely from the head trauma because trauma is something that can give you Bell's palsy. And for plan, I was going to follow a flu swab because viral illness can sometimes give you Bell's palsy. And I was going to give him prednisolone 60 milligrams daily for 5 days from April 1st. And when a medication is only given for a fixed duration of time, for example, antibiotics, and in this case, prednisolone, I always write the start date so that at the time of discharge, I don't have to dig into the electronic medical record to find out how many days I have to give this guy. Now, one of the other things I like to mention about is that you can see that I did not talk a lot about differentials. There's a lot of things that can cause Bell's palsy. Lyme's disease can cause Bell's palsy, sarcoidosis, you can have herpes, you can have some kind of cancer. Now, if I'm not doing anything about those differentials, I do not like to write them. And again, like I told you before, the longer your differential goes, the lesser the accuracy. In this case, I thought it was just from head trauma. And because I was not doing anything, I didn't write it. If I was going to do a CT of chest to check for sarcoidosis or some labs to check for Lyme disease, then I would write it down here. I'm going to do CT of chest to check for sarcoidosis, or I was going to do test for Lyme serology. But if I'm not doing anything, I do not like to write them as differential. Now that's just my way of doing things. The other problem he came in with his vertigo. Again, I thought it was worsening of his baseline from head trauma, and I wrote his home medication down. Now, one can argue that home medication goes in the medication section and not here. I usually leave it here because when I'm discharging patient, I quickly glance through my assessment and plan to decide what is someone's home medication and what is not. But you can just leave it in the home medication and not talk about it here as well. And we had done a CT head was unremarkable. In this case, we consulted PT for discharge disposition planning. And again, you need to think about discharge from the day one someone comes into the hospital. This guy was not able to walk really safely. So I brought in physical therapy to see, like, hey, is this guy safe to go home? And we're going to do a MR of the head and MRV to check for other etiologies. Again, the differential of vertigo can be really, really broad. And, I just left it that I'm going to check for other etiologies. Again, it could be vestibular neuritis can cause vertigo. Meningioma can cause it. You can have some kind of other brain tumor. Again, there's a lot of differential, but unless I'm not doing anything about it, or unless I'm doing something about it, I would not write it. And I wrote about the medication I'm going to give, and I consulted neurologist, so I just said like follow up Neurorex. The other problem this guy had, he had a headache. I thought it was post-traumatic from trauma. And then the other thing I said is that it could also be debilitating version of his old migraine, even though this feels different. And I wrote about the the medication I'm giving. Consider adding Valium if this is ineffective. And again, follow up MRI of the head and follow up Neurorex. So usually this is the usual depth I go in terms of my assessment and plan. Again, different people have different styles. So don't feel that the way I do it is right, the way other people do it is wrong. Just try to adapt a style that you find helpful. Thank you for watching my video.